On July 1, 2025, the U.S. Senate delivered a blow to rural America by rejecting Senator Susan Collins' amendment to boost funding for struggling rural hospitals. The proposal aimed to provide a financial lifeline to facilities that are often the only source of care and jobs in their communities. The vote wasn't close, 78-22 against, with both parties overwhelmingly opposed. For millions relying on these hospitals, the outcome raised urgent questions about the future of rural healthcare. Rural hospitals have faced years of financial strain, low patient numbers, high costs, and a growing risk of closure. Senator Collins warned that without federal help, many would shut down, creating healthcare deserts across the country. The amendment's defeat wasn't just about money. It exposed deep divisions over how to fund and deliver care in rural America. Even popular ideas like saving local hospitals can get lost in the crossfire of partisan politics and competing visions for healthcare. Senator Collins' amendment proposed doubling rural hospital funding from $25 billion to $50 billion over 5 years. The plan would have expanded eligibility, helping not just hospitals but also clinics and nursing homes in rural areas. The most controversial part, paying for it by raising taxes on the wealthiest Americans, those earning over $25 million a year. Collins argued this was a common-sense fix, a small tax on a few to protect healthcare for millions. She painted a stark picture of rural hospitals on the brink, urging Congress to act before more communities lost their only lifeline. But the tax hike made the plan a tough sell, even as the need for relief grew more urgent. The amendment's defeat left rural providers facing an uncertain future. The amendment's failure was driven by a rare bipartisan alliance. Most Republicans opposed any tax increase, even for rural hospitals. Democrats, meanwhile, argued the amendment was too little, too late, a Band-Aid on a much bigger wound. Only a handful of Democrats supported Collins' plan. Most saw it as a distraction from the GOP's proposed $1 trillion cut to Medicaid. They refused to back a small fix, while the larger bill threatened the very survival of rural healthcare. Senator Collins called the opposition hypocritical, but the divide ran deep. For Republicans, it was about taxes. For Democrats, about not legitimizing a bill they saw as catastrophic. The result: rural hospitals caught in the middle of a political standoff. At the heart of the fight was the GOP's sweeping Megabill, which included a $1 trillion cut to Medicaid over 10 years. Medicaid is a lifeline for rural hospitals, covering many low-income and elderly patients. The bill targeted a key funding mechanism: state hospital taxes that draw down federal Medicaid dollars. Conservatives called this a budget gimmick. Hospital advocates called it essential for survival. The Megabill would cap these taxes, slashing federal support and putting rural hospitals at even greater risk. Collins' $25 billion amendment was seen as a drop in the bucket compared to what the Medicaid cuts would take away. For many, the debate was about more than one fund. It was about the future of healthcare for America's most vulnerable. The stakes: whether rural hospitals can keep their doors open at all. With the amendment's defeat, rural hospitals face a precarious future as the GOP Megabill moves forward. Without extra funding, these facilities are exposed to the full impact of Medicaid cuts. Community leaders and hospital administrators are left anxiously awaiting the final vote. For Senator Collins and a handful of swing senators, the next decision could determine the fate of rural health care. For small towns, this isn't just politics. It's about having a doctor nearby, an ER in an emergency, and jobs that keep the community alive. The loss of a hospital means longer drives for care, lost jobs, and a weakened local economy. The fight for rural healthcare is far from over, but for now, small towns are left waiting, hoping for a lifeline that may never come. The battle over the Collins Amendment was just one chapter in a much larger struggle for the future of rural medicine.